Hi everybody, Dr. Ellie Stein here, answering a question that was emailed me earlier today by someone who's participating in one of my self-study courses. She's asking about neuroplasticity. The question is, I have ME, smell and sound sensitivities. You say that these symptoms may improve with neuroplasticity-based practice. But what if the symptoms are due to an underlying condition? In this case, she's asking about MCAS, but you could fill in the blank with any underlying condition that you have. So here's my response to the question, and it's a really great question and a really common one. First of all, we are all different. No two human beings are the same, and even two people that experience very similar symptoms might have them for different reasons, and therefore will need different strategies or interventions to address them. Secondly, the mind and the body are so interconnected that most symptoms are influenced by both the mind and the body. Some, of course, seem more body influence, some more mind influence, but there's no, artificial dividing line between the mind and the body. We are all one. So what this means is that symptoms primarily generated by the brain, and this would include chronic pain, sensitivities, and mental health symptoms, in my experience, are the most likely to respond more fully to a neuroplasticity-based approach. However, once we change our brain, we also change our body, because we change the output of hormones, peptides, neurotransmitters, immune molecules, nerve signals, and so forth. And those all travel immediately throughout the body. So even people who have stubborn physical symptoms like severe fatigue, that I'm often a little bit cautious about making too many promises about, some of those people get better. On the other hand, people who have symptoms that I would expect to respond sometimes struggle to improve. In my own case, my multiple chemical sensitivity, which I had had for my entire life, which has some genetic components because I've had testing, and which both of my parents had, so I came by it really honestly, unexpectedly improved very quickly and fully with neuroplasticity-based practice. On the other hand, my very severe food sensitivities, which affect all kind of body systems, have not responded, and I've been practicing most days for over 10 years. I'm not giving up because I know how powerful this practice is, but just to say, in one person, some symptoms might respond more easily than others. My suggestion is to go into neuroplasticity-based practice with confidence. Believe that change is possible, but know that you cannot predict which of your symptoms will respond, how fully they'll respond, or how quickly they'll respond. That's just the way of life. I wish you all the best if you're someone who's embarking on neuroplasticity-based practice. Keep your questions coming. I love them, they're challenging, and they make me think more deeply about what I believe and why, and sometimes they lead to further research and I get to learn new stuff. All the best.